The chair of the beleaguered Waikato DHB says she can no longer assure the health minister she can get the job done. The minister has told the DHB's board he is seriously dissatisfied with its performance and he's considering replacing it with a commissioner. David Clark has cited the District Health Board's deteriorating financial position, with last year's deficit of $37 million expected to balloon out to $56 million in the current financial year. Sally Webb is the chair of the Waikato DHB. I spoke to her just before we came to air, and I asked when she heard the minister was considering sacking the board.
It's not the first indication I personally have had. I have had a previous conversation with the minister about the potential of having commissioners appointed.
And when did you have that conversation?
I've had that conversation when I've met with the minister the last couple of months.
So do you want a commissioner?
What I want is strong, focused governance for Waikato District Health Board. And for some reason, one reason or another, as a board, we have not been able to fulfil our obligations in that role.
That sounds like, yes, you do want a commissioner.
I think that will be up to the board. As you know, the minister has sent a letter to the board and we have until the 3rd of May to reply to that. As a board, we haven't talked about that letter yet.
But I'm asking you as the chair, have you recommended to the minister that a commissioner is what you believe would be the best course of action in this case?
I've talked to the board about to the minister about the advantages of having a commissioner, yes. And personally, I believe the appointment of a commissioner is the right move to ensure that Waikato District Health Board has the trusted, focused leadership it needs to address the challenges it faces.
Why can't the board get it together?
If I knew the answer to that, we probably wouldn't be in this position.
So let me put it another way then. What is the dysfunction that you are seeing?
There are a number of issues that the minister has outlined in his letter that the board has been unable to address sufficiently.
What specifically?
One of the most important, well, if I can talk of one specifically, but I'm not going to go into a lot of detail until the board has had a chance to talk about the minister's letter. But one of the most important roles for a board is the appointment of the chief executive. And as a board, we had to halt that process earlier this year when we were unable to appoint a suitable candidate. So, you know, that's one of our most important roles.
So why have you been unable to appoint an appropriate chief executive? What's the stumbling block?
Candidates actually wanting to apply.
So what do you mean by that? Have some of them pulled out?
Look, that was a process that happened back in February. Lisa and a candidate withdrew, yes.
Why?
Sorry, why?
Why did the candidate withdraw?
I'm not going to discuss that sort of thing in public. That's the candidate's prerogative to do that.
The minister has talked about his increasing concern over the DHB's deteriorating financial position, right? So your deficit, reported deficit 2017-2018, 37 odd million. 2018-2019, it is 56.1 million. Where is all the money going?
Well, the money is going on the provision of services. And, you know, we're not the only DHB that is in financial difficulties. But what we need in Waikato District Health Board is actual focused governance that can support management to implement a plan to make the organisation sustainable. We've been doing some work on it. Please don't think this board hasn't been doing any work. We have been having work around our financial sustainability and doing some significant work there. But we need to actually have that carried out further and implemented more.
Well, let's be clear about this. Is any of this misstep spending, or is it just the cost of providing healthcare, or have you got inefficiencies? That is a significant deficit track. What is the primary reason for it?
There is no, it's not a simplistic answer to say there's a primary reason for it. It is about the cost of providing services. It's about looking at patient flow through the hospital. It's about looking at how we relate with primary care and move services into the community. There's a wide range of issues that underpin financial performance. There's no simple way to describe it.
And people will understand that. And you say that you're not the only DHB with financial issues, but you are the only DHB that we are currently aware of that the Minister is thinking about putting a commissioner in. So something serious is going wrong there. Governance and leadership. You say you need focused governance. What is the problem with governance in the board at the moment?
I think you will be aware that this board has had a lot of public disagreement, which has been present about a number of issues for the term of at least this board, and that undermines trust and confidence in the board.
So is that personality issues or a difference of opinion on direction for the DHB?
There's no difference of opinion on direction, and I'm really not going to get into individual issues because, as I've said, the board actually as a group hasn't had the time to discuss this.
Okay, so let's return to the CEO. So how long's it been that you have been without a permanent CEO?
It's got to be over 18 months.
Right. How can you get ahead as a DHB without someone in that role permanently?
Well, we have had an extremely good interim CEO in the position, but that is one of the issues. We need the appointment of a permanent CE.
And he's leaving. Why is that?
I'm not going to discuss that.
Are people withdrawing their applications and others don't want to stay on? Is that directly...
We're not in the process of appointing a CE at the moment. We withdrew.
Yeah, so you've suspended... you've suspended the search. So why? Why have you suspended the search when this position is critical to the advancement of the DHB, to getting things back on track?
I think that is... the board has been considering, at its last meeting, it considered what it could do about the appointment of a chief executive. So we are looking at how we do the process.
But that doesn't explain why you suspended the process. Why did you suspend the process?
That was all fully discussed at the time, Lisa, and I don't see any sense today in dragging that all up again.
But these are all contributing factors, aren't they, to why the Minister would be looking to bring in a commissioner?
There are a number of contributing factors, and I don't think it would be any surprise to anyone that Waikato District Health Board has been a board under stress for a while.
So you said that you are basically recommending to the Minister that a commissioner could be a useful way to go. Is there nothing more the board can do?
I didn't say that. I said I had discussed the possibility with the Minister.
Right.
So I think it's really important that the board has the opportunity to respond fully to the Minister's letter, and that in that response we will then outline the way forward.
That's the whole board. I'm talking about you as the chair and your personal preferences. Is there nothing more that you can do in the role that you are in? It's game over for you, is it?
I believe that it's my role as chair to be able to assure the Minister that I can provide focused leadership for the organisation, and I've been unable to do that. So yes, I guess we would call it game over.
So if we extrapolate that out then, Sally, that means that you need a commissioner, and in your view, you need a commissioner because you are no longer able to offer that confidence to him.
Yes, I wouldn't disagree with that. I no longer have my confidence in my ability to give the minister cohesive leadership.
Sally, what assurances can you give the public that this DHB is delivering them quality health services and care, given everything that you have said to me today?
I can give them very strong assurances in that. I mean, Waikato District Health Board has really committed health professionals in it. We have been doing some, if you look at the good news stories that do get out there occasionally, there's some really focused, stunning work going on. And people are receiving services every day.